Thank you very much, and it's great to be back in Athens. We were here earlier in the year for World Cancer Day for an excellent conference, and at that conference, we'd worked very closely with ELOC to produce a country report for Greece, which was a range of indicators at the EU level and how Greece compared on things like cancer survivorship and mortality, screening, prevention, etc. So we're very pleased with our report, and we published that on the morning of World Cancer Day. But very rapidly, that report became out of date by the afternoon because that afternoon, the health minister announced that some of the indicators we had, that there wasn't a Greek cancer plan, that there wasn't a Greek cancer registry or a right to be forgotten, all of those things are going to happen. So there's a real, it feels to me, a sense of momentum in Greece from what we can tell from different countries we visit. And it's great to be at a conference like this where we're really getting into the nuts and bolts about how to finance some of the ambitions that Greece is building. So we're delighted to be able to publish today a new country report that updates from that version in February. Published in English today, we'll be publishing a Greek version in the weeks to come with commentary. So please look out for that. But you can find that at europeancancerpulse.org. But I was asked to say maybe a little bit about how to finance ambitions in Greece on cancer through many of these EU funding streams. And I think there's been some great presentations there that have just opened everyone's eyes to just the number of funding opportunities there are. But I wanted to relate some of the experience that we have as a European body trying to help and assist our member societies, patient organizations, and others from all over Europe come together to respond to some of those calls. And I wanted to maybe just give some tangible advice to anybody who's here from an organization, a university, a cancer center, that is perhaps not at the moment part of these funded initiatives, how to get involved. And I think it starts with maybe just getting familiar with some of those calls. So a great website resource is the EU Funding and Tenders portal. And if you visit there, type in a search term, cancer, already you'll see today all of the open calls that you can reply to. You have a number of facilities at a national level there to help and support you. So you have national contact points for EU for Health and other funding streams, who it's all listed on the Commission's website, and you can connect there. You can also connect with a brand new project called ECOS, which was just mentioned, Cancer Mission Hub. So there's a developing Greek Cancer Mission Hub specifically designed to help new institutions connect to mission funding calls. But I would like to also say there are informal networks you can join, like the European Cancer Organization. There are others who try to provide information to its members and people on its distribution list, try to help people connect to consortiums. And we're busy doing that at the moment for all of those open funding calls that are available. So we're here today to increase our connections with people in Greece and hopefully play a role in supporting those numbers. About 4% I see of the budget for Greece. We can probably get those up with a bit of effort to maybe 6, maybe 10% of funding to Greece, we would hope. And I think just I wanted to also relay, be on having your eyes and ears out for calls before they become published. So every year you'll see the work programs announced, maybe even a year ahead of the call being published. And that should give people time to start thinking about consortiums to build, what they might like to respond to the call, because those work programs give a reasonable amount of detail of what can be expected. So it's good to be forewarned and prepared, and hopefully that takes you towards being a successful recipient of EU funding. So for us, we've felt from our time in Greece, it's been a very successful collaboration with ELOC and other partners here. We're hoping to do more and more of this connection between what's going on in Brussels, what's available in terms of funding, and making sure that people at national level are able to participate in that. So we're delighted to have welcomed ELOC and the Hellenic Society of Medical Oncology as our first associate members, and we're hoping to build and develop that work further. So thank you for inviting us to be here today.